Cabinet says embattled Health Minister Dr. Zweli Mkhize's leave of absence will have no significant impact on the country's response to the COVID-19 pandemic. The acting minister in the Presidency, Khumbudzo Ntshavheni, gave the post-cabinet media briefing at the GCIS offices in Pretoria. She joined Newzroom Afrika's Zweli Mkhize on the sidelines.
The post-cabinet briefing here at the GCIS, and the Minister Khumbudzo Ntshavheni gave quite a condensed briefing about that, but there's just a few more elements that I thought maybe we can just touch on. Joining me now is the Minister. Minister, I think the first question that we need to ask is, since the Minister of Health, Dr. Zweli Mkhize, has been placed on special leave, was it part of the agenda in Cabinet? And what impact does his leave also have on the pandemic now, on the response to the pandemic?
Thank you for the question. We didn't discuss the matter of the special leave of Minister Mkhize. As you are aware, the President has appointed Minister Ngubane as the acting minister, so there is no vacuum. And just to clarify, the work that Dr. Mkhize was heading on the vaccination, for example, it was led from the IMC on vaccine, which is chaired by the Deputy President of the Republic, and it has a number of ministers participating because it's a collective effort. It must be remembered that the work of Cabinet is not a work of the individual, it's the work of all of us, though we may be at the front line or become the face of that particular work, but is the input of all ministers. And in terms of the work of managing the pandemic, ministers are not responsible for executing. It's the departments that's there, and you've got a full department with staff. You've got the provincial departments of health and the MECs that are in place to run. So the impact of that of the special leave is negligible, because it's an individual who's on leave. It's not the whole of the Department of Health or the whole of the provincial departments of health that are on leave, and the staff continue. The nurses and doctors that continue to do the work remains there. The community health workers that continue to mobilize for vaccines or to make people aware of the things that have to be done to manage the pandemic, they remain there. And we appreciate the contribution of Dr. Mkhize in that work, but the team that has been doing the work remains in place, and they continue to do their work every day. That's why we're still releasing the statistics on vaccines, we're still releasing the statistics on infections, we're still doing what was being done normally without any change.
Well, definitely. And perhaps on moving on another matter here, let's talk about Eskom. Even though you had perhaps talked about the power generation that you continue to request that will go onto the grid at some point, but now power cuts across the country, I'm sure Cabinet is worried about that.
We have expressed the concerns of Cabinet around the continued power cuts and the infrastructure of Eskom. It is for those reasons that the Department of Mineral and Energy has announced the bid window 5 that is open, but also the other measures to get the municipalities to procure the alternative powers from other sources to make sure that we alleviate the grid, but also the announcement that was already made by the President to increase the limit from 1 megawatt to 10 megawatt to just registration, to make sure that we can have the electricity available. But also the discussions that remain underway of saying, can the cap from 10 megawatt be lifted to either 50 or 100? Those discussions are underway, and the Department of Mineral Resources and Energy continue to apply their minds and see what is possible and the impact thereof.
Minister in the Presidency, Khumbudzo Ntshavheni, thank you very much for joining us here on Newzroom Afrika, just giving us that response that Cabinet is worried about the ongoing cuts that Eskom really is implementing across the country. For Newzroom Afrika, Channel 405, I'm Zweli Mkhize in Pretoria.